Quilcene. Sorry, that interrupted. Okay. We haven't been able, unfortunately, to find somebody for Brennan. I know that Trish is joining us now, and that's been a source of discouragement and frustration for her, I'm sure, and certainly for us. We have a meeting planned to meet with Julie to look at next year's, what's available for next year, and we're starting to think about now, how do we find staff for next year? Because right now there just is a shortage of clinicians that are available because the demand is so high everywhere.
Mm-hmm.
Our student assistance professionals, we also have, so that they do that prevention, early intervention, behavioral health services with a focus on substance use, but at this point more of a focus on depression and anxiety as well, and coping skills. And so we have a staff person at Blue Heron, Chimacum, junior senior high school, and in Quilcene. And we're also through a different grant, so that's the CPWI grant, our Community Prevention and Wellness Initiative. And then through a different grant, we're also interviewing, third round of interviews for somebody at Port Townsend High School. We did have somebody that we offered the position, but they chose to a clinical position instead.
I see. Okay. Well,
so staffing has been challenging, but we're trying to get supports in the schools.
Thank you. How about Julie?
Thank you. So on the broader spectrum, we just hired 3 new therapists and for private practice, one in Kansas and one in Montana. So we've kind of expanded our reach. Their license in the state of Washington, so they're able to see people through telehealth. One is a child specialist, so we're really happy about that. On the school front, I just hired, or in the process of hiring, a therapist that's specifically for Blue Heron and 1 day a week in Brennan. And so we're hoping, Trish gets to meet her tomorrow. So we're hoping that she's a good fit for Brennan School. She has a great history with working with families and with sexual traumas, with working for over a year with, I can't remember the term, trafficking adults and trafficking kids. And so she has a really depth of experience working with individuals. So we're excited to have her join our practice. She potentially could be our full-time school therapist. We're talking about that, and she loves working in the schools. And so and she doesn't come on till March 21st, so about a month out. So it's, so we're talking to Blue Heron about her starting. We do have Octavia. She is an intern. We got her in the schools before Jillian came in the picture. And so Blue Heron was great to be willing to have an intern come in. The need is so great in Blue Heron due to parent deaths and just the need. And so, so we're, one of the reasons or the hesitations that we had with moving forward with the contract with the schools was that I didn't know if I'd be able to provide therapists in the community or therapists in the schools long-term. Rebecca is planning on not being in the schools. And then Anne was planning on leaving at the end of the year, and Elizabeth was going to leave at the end of the year. So this fear of mine of not being able to provide services, I wanted to make sure that there was a foundation set up so that if we're not able to provide the service, there was other resources to be implemented. And so, but right now, and with talking to Ciela next week, we're hoping to still be part of that, and at least in a process of finding therapists for that position. So that's I would say our update. We got a new contract with Fishline. It's the food bank here in Paulsbo. And she's a full-time therapist embedded in the Fishline, and it's been amazing. She's been here for almost 2 weeks. And so there's these little pieces of providing mental health support in the community of where we can. So that's our update.
Thank you, Julie. Go ahead, Case.
Yes, could you remind me what the name is of your organization? And when you say therapist, what kind of, how are you using that term?
Oh, thank you. Yeah. So my practice is MCS Counseling. We're a group. We currently have 25 therapists, and we're based in Silverdale and Port Townsend. We have 4 therapists in Port Townsend right now. And we have a plan of having 3 more come on in the next month and maybe another one. So 4 in the next couple of months. So we're growing exponentially. Our philosophy is creating a safe place for therapists to grow. And so we're working a lot with associates and creating a supervision component. So our levels are master's levels, associate levels. We have about 5 therapists that are fully licensed. And the rest are associates, which means that they're 2 years in supervision after their postgraduate. And so that's what I mean. We have most of ours are LMHC, so licensed mental health counselors, and we have about 5 social workers on staff. Yeah.
All right. Any other questions before we move on? Dr. Parker? Yeah, you were here. We're just looking for updates. Anything that you want to share with this group?
I don't have any updates except from the primary care standpoint. Can you hear me? Hi. Is that better?
There we go.
Okay. I don't have any updates other than from the primary care standpoint, we still see a huge need and still struggle with coordination, especially for the state-funded folks. One of our constant struggles is that balance of privacy between medical issues and mental health issues. They're often combined during a visit with us. And so teasing that out for parent privacy is something that we are learning and growing on constantly. It's just fresh in my mind right now, but otherwise we appreciate hearing about all the expansions and availability in the school. If there's ever an opportunity as organizations send out flyers or leaflets, even sending out a set of pictures of people with their bios would be lovely. A lot of times the hospitals in Seattle will do that or come visit pre-COVID, and that just gives us a face and to a name. And sometimes that can be really helpful and a little bit more of a warm handoff as we send folks out into the therapy world. So just something to consider. But yeah, no big updates from us. Thanks.
That's a really good idea. Kate?
Molly, I'm wondering, to the other end of the youth age spectrum, any word on the Commerce Grant for childcare?
No, but we're listening very closely. It looks like their website now says mid-March for that, for letting us know. They did give us a $25,000 extension from the prior Commerce Grant. So we're hoping to use that to start some of the work around feasibility and things that we would need to do otherwise with that money. But yeah, we're just in a holding pattern right now.
Okay, thanks.
But we are on that end of the spectrum. We are working with First Steps to start a diaper bank, and our Cribette program is going really well for safe sleep. So we have some fun stuff going on too.
That's great.
Thank you. Any other questions for Molly? Lexa?
I have no updates. I'm just grateful to listen and learn, and hopefully you can tolerate watching me eat. Thanks.
We're all wishing we were if we aren't. Case? You might be on mute.
The only thing that I'd like to add to this wonderful array of things that we're all doing is that I'm looking forward to the Board of Health meeting later this afternoon, at which we will hopefully, and I don't see why we wouldn't, adopt a proposal for public health to really take on CHIP with some funding from the city and from Jefferson Healthcare. So just looking forward to that.
Thank you. I agree. I'm with you there. Commissioner Dean? Commissioner Dean?
So I don't have much of an update. I will say I was thinking of you all. I don't know if anyone mentioned this, but just the loss of a young person in the community going almost 2 weeks ago now, and was wishing I could have you all in a meeting just to kind of, I know that you deal with this all professionally often, and just such a hard hit to lose a young beloved person here, and kind of heartbroken about it. But on a professional note, for me, I'd say just something to be aware of. Today, the governor is having a press conference at 2 o'clock. He'll be talking about the rescinding of the mask mandate in indoor public places, and we have an idea that will be in March sometime. And I don't know if you know any differently, but as of yesterday, the health officers were still really uncertain which direction he was going to go with schools. And so just know that we're the county has a certain role to play here. Likely, we will not be involved in the school decision, even though Reichdahl recommended that decision be made at a local level. We're really hoping that that is not sent to the local level to decide. And I know it's very controversial, and I hope that hasn't been, you all haven't been caught up in that too much.
Thank you. It is a complicated time. Jean?
Okay, I just finished eating. I apologize. Very hungry, apparently. So I'm a jumping mouse, and updates from here are that I am stepping out of my role as clinical director coming in May. We're about to post the position the beginning of March. So if you think of anybody that would be great, we're really looking for somebody to focus on supervision and learning our model and kind of really working to hold the clinic and less of an administrative role. I've been kind of doing both. So we're trying to kind of tease them out so that we can really have somebody come in and focus on our therapeutic work. I'm going to be staying at Jumping Mouse. I love this work. I just really want to work with kids again and really focus on that. So I'm going to continue to be here and supervise some therapists and work with kiddos, but I'm going to hand off some of the responsibility I've had. So that'll be in May. That change is happening. And I'll send out the job description once we're posting it to all of you, so you can share it. And then other than that, excuse me, I think people here know, but I'll just say it again. We have a therapy room in Brennan at the Brennan School District where we're seeing 8 kiddos there. We have 1 therapy room now at the primary school in Chimacum where we're seeing 8 kids. And we're planning to create a therapy room for the elementary school in Chimacum next fall, where that's the role that I am planning to move into, where I will be seeing 8 kids there. And then we'll have some established therapy rooms in those schools and can start looking at, do we want therapists there more days than just, to see beyond 8 kids in each of those schools. So that's kind of where we're at in terms of our growth and our capacity. So.
Thank you. Anybody with questions for Jean? Okay, how about Trish?
You guys do such amazing work, Jean. I'm looking forward to meeting who will likely be our counselor tomorrow. Julie always sends us really good candidates, so I'm sure I will like her very much. And we've been without a more traditional counselor for our older kids all year, so that will be really great. And I'm also anxious to see what's going to happen this next week. Kate, my meeting yesterday, they indicated it'd be, well, you heard Chris Reichdahl probably say he thought it'd be mid-March. So, and he thought it would be for schools too, but I don't know what the how the county health will be involved. So anyway, but other updates that probably aren't related, but I have to share them because I might pop if I don't, are that the state report cards are out for school districts, and go look at Brennan. I mean, we set it on fire. So, and then we've got three facilities grants this fall. We have a $200,000 one to remove our old asbestos gym floors and put in new ones. We have another one for the ancient entry doors we have where you have to brace yourself with 2 feet and pull. They're going to be replaced, and that's $100,000. And then another 200 for the front of the building, where years ago we had a community work crew that took the windows out and put up plywood. So it's going to be energy efficient and awesome. So unrelated, but I just got to share it. So
That is all exciting news. Sounds like it's the place to be these days.
to me, it's very exciting.
How about Cynthia?
Hey there, I'm in the car, so sorry, no video. We don't have too much to share, just we are doing an after-school program through 4-H in Brennan, and we've got in-school classes happening in Chimacum right now.
Good to know, thank you. Susan?
Are we doing updates? Sorry, I'm late.
No worries.
I just finished my CPR again for 2 more years. I don't think the last time we met that we were all in place with mental health providers, but we are now. So I think that's our biggest, most exciting update. I can't think of anything else specifically. Yeah.
Okay. Well, maybe what I'll do before we pull up the actual framework, which I'm kind of sliding to the end of the docket here, I'll go over just some updates that we're thinking about around funding, because I know that's been a topic of conversation here. I'm going to share my screen. And Trish was good enough to sit through a very complicated effort on my part to explain this yesterday. So hopefully, Trish, this will be better. Can you folks see that screen? Let me get it so that I can see you. So some of you likely know that the Behavioral Health Consortium, which comes in under the CHIP umbrella, has a grant that is currently underway. The performance period will end in August of 2023. And so I'm just laying this out before I go into the details of the 2 of the grants. So that grant will end in August of 2023. We have a grant that we're looking at pursuing right now. The application would be due in April. It would be for $500,000 a year. And it's for the time period going from, actually, I think it's from September 2022 through August. So that would be the first year, all the way through August of 2026. Then we also recognize that coming down the pike is a 3rd grant, an RCORE implementation, which is the same grant that we have now. It would just be a re-upping of that grant, but it may be less than the $1 million that we got this time for 3 years. So up to $1 million, a 1/3 of those funds would be available for programmatic funding, and that would become available in September of 2024 and go through August of 2026. Right now, in the currently funded grant, we've just done a budget amendment, and I've added in 2 things that we've talked about at this group: some funding in both year 2 and year 3 for some suicide prevention programming. And I also put in some for the youth expert program that there's a possibility of starting up, and I put that in for year 3. So those are things that we've talked about here that we sort of looked around and found some funding for. In the course of looking at this behavioral health care support grant, the one that's worth $500,000 a year from September 2022 through until August of 2026. I had a conversation with Scott Mock, and one of the things I knew that we wanted, with that extra funding, I wanted to see if we could do something that made sense to add a robust approach to the school segment of our population and of the service that we are working to get our kids connected to. And what he said, and maybe Trish can speak more to this than I can, but in the short conversation I had, and if you go to this link, there's some notes on that conversation. He suggested that the 4 school districts get funding for an internal behavioral health services audit. And that would allow them to understand what they've got, how folks are using it, where there's coherence, where there isn't, where there's an opportunity to create some. And then the second thing that he noted would be really worthwhile is a school liaison interventionist position that was the schools to sort of hold and disperse, more so than that it's an outside agency who has control over the supervision and the hours and the what can and cannot be done by that job description. So in the proposal that I'm putting together for this particular grant, I'm going to put in these 2 things as major parts of that budget, and you can see what I'm sort of lining out. The rest of the budget would go to continue programs that I have already going in our current program, right, or in our current grant. The third grant that I talked about as a possibility, I haven't even begun to think about it. There's a chance that if we got this one, maybe I don't go chase that third grant. But if we don't get this one, then I will definitely want to chase it so that I can at least continue what I've got or look at moving things around and seeing how we can help the schools just with that smaller pot of money of that third grant. So that's a little bit of an overview of some of the thinking that I've been doing. Ciela and I just had a short exchange before, so there may be some looking at if that suicide prevention training is even something that the school can use or, you know, has the bandwidth to implement at this stage. Maybe it's that we need to rethink how that funding is allocated in our current grant. I'm open to thoughts. Trish, if you have anything you wanted to illuminate around that audit, it sounds like it's a conversation that the school districts have been having together.
Well, I mean, my only comment is Brennan's always going to look strange on an audit because we're so small and because our socioeconomic level is higher than the others. So we're always going to look, you know, now 5 years ago, we'd look understaffed because we had 0 counselors, but it'll look odd always. I think whoever's auditing needs to bear that in mind a little bit. So
I had the sense that he was saying the word audit and I was thinking the word assessment. And maybe I've misunderstood, but I've got notes that were pretty much word for word of things that he was saying at the time. My sense was that he had the perception that there might be just better ways that resources could be shared or distributed, and that he was looking for those possibilities. And I also explored with him if maybe the school-based program could be a part of that assessment or audit, whichever we're calling it, because there may be, I don't think he had a lot of depth of knowledge about the school-based program, and maybe there's an opportunity for just some synapsing to happen there that would be helpful. And then the school liaison interventionist, he hasn't sent me a job description yet, but that's the next step in our, so I don't know what all that will involve or how it would affect Brennan.
The audit or assessment doesn't seem super important because there's only 4 of us. We could tell you what we got pretty quickly, but I don't know, but that's just me.
Okay.
But I'm not opposed to it, but.
Right. Well, thank you. It's good to have that insight. Are there?
I just wanted to add, part of my role when I started was to do a needs assessment and gap analysis with our school districts in the 4 counties. And so I don't necessarily have information I can share directly, but I think that it sounds like that's what he's looking for, is really to determine what the needs are, what you have available, what those resources are and where the gaps are and how to fill those or shift resources. And so if I can be support around that, I'd be happy to.
And when I say Brennan will always look funny, we're just, even when they put out percentages of things, we're so small that they don't publish our percentages. So it's just,
Right.
It's fine.
Are there other thoughts as I start to chase this grant and put together budgets and work plans, Jean?
Okay, so this is going to be partly my naiveness around how these kinds of processes work, but I do know that there was recently, an experience in this group that might inform it in terms of the kind of assessment that went toward, the whole project that was assessing like what childcare we have available in our community and what's needed. For me, when I think of just 4 schools and I look at, or school districts, and I look at that $60,000, of course I go, well, could we spend that on programming more than an assessment? Does it really need $60,000, and how helpful is it? In my experience, we get those assessments. I think we already know a lot of our gaps, but it does help to define what they are. But I guess I worry that we get that assessment and then we still just don't have funding for what's needed. And so I guess I'm curious to hear experience from other people who've actually kind of walked that kind of path. And I know Molly, I'm looking at Molly, so I'm curious because you've been very involved.
Sure. I think I can completely relate, because with the childcare issue, we all know that there is no childcare and we need more of it. So why do an assessment? But the numbers were really helpful to us to ask for more funding to go further, and also to delineate what the community, in the case of childcare, what the community was looking for regarding childcare needs too. So it gave some more oomph to our future applications, and I think let the outside world know what we already know in terms that they can understand. So for us, it was helpful, but I agree, sometimes it feels like just give us the money for childcare.
Mm-hmm. Okay, that's helpful to hear, because I've never been a part of that process before. So
Also, I guess I do apply for a lot of grants for Brennan, and so sometimes having that document will help me. So that could be helpful too, to reel in some more funding from different grant sources.
I think also some of what I'd like to accomplish in actually providing school districts with funding that they have agency over is that then we aren't sitting in a group out here proposing what we think they might need when it isn't informed, or there hasn't been cross-pollination of their input or insight or a chance to sort of think carefully about it themselves. And the audit or assessment, whatever we're calling it, it might not cost 60, maybe it costs 40. I'm just putting some round numbers in there to sort of get a sense of, okay, if I put this chunk towards schools, what do I have left to put somewhere else? I am absolutely certain if less was spent, we'd figure out ways, or the school would figure out ways to make sure that money gets contracted, to something that's needed. But I know, he spoke very highly of what Jumping Mouse is doing, and just wanting to have a clear idea of how many kids and where. And because I know I tried to do my own little rough draft assessment, it would be nice to have somebody who did it in an official way. And it was their job to very cleanly line it out. And it also, as Molly was saying, it kind of gives it a readability or an accessibility factor that just this group alone probably doesn't carry on their own. Other thoughts, questions about that? All right, I'm going to switch over to our strategic framework, unless there's something else folks would like to cover beforehand. Okay.
If I could, Lori,
Yes.
if I could just make one quick comment. I noticed on the future grant application, you were putting the Recovery Cafe again at about $38,000. And just want to say, if you haven't had lunch at the Recovery Cafe, you're missing something. So check it out on Thursdays at, I think it's 12:30 or about 12:30 to 1:30. And it's
Thank you.
It's an opportunity to mingle with a part of the community that we often feel a little shy or squeamish about mingling with, and it's just a great opportunity for everyone, I think.
Thank you. Brian Richardson has done such a job over there, pulling that
Yeah.
together. I really appreciate working with. Okay, skipping over quickly, and I know we're at 12:47, so I'm watching the time. I'm almost tempted to start from the back of this document because we always start at the beginning and then don't get to finish our input. So here we are at, let's look at the first strategy on this page. Are there any updates to this line about identifying adults who interact with teens? Just giving people a chance to read.
I have a,
Go ahead.
am I still unmuted? I can't.
No,
see.
I can hear you.
Okay. Yeah, in terms of adults who interact with teens, I assume that we have the mentorship program at the high school. I've been a part of that group for a couple of years, and that's a group called Skill Nation. So do we have them as potential?
I think because we haven't.
Oh, there we go. Yeah.
Can you hear me now? Because we haven't been working, we've just been updating each other generally about what's going on here. When CHIP gets sorted and what it is, then we'll actually put some time on this. But thank you, because making sure to have that Skill Nation in the mix, of course, important.
Thanks.
Any other comments on that page? Okay. Here we were talking about creating a safe space, and what I can tell you is John Nowak is going to be going to the Fort Worden, what's it called? The PDA, is it called? He's going to be going to them, but we haven't done that as yet. I'm not sure if it will happen in March, but if not March, April. So that's my update there. Anything else that folks, I know that there was a strong desire to make sure that we were looking at more than one possible location. And if others have thoughts that have come to mind or ideas that we should chase down, we'll welcome hearing those as well.
You're aware of the fact that Fort Worden has completely reorganized, and that there's a group called the Fort Worden Hospitality, which is a separate nonprofit that is now running all of the facilities.
Okay.
And I think they would be the ones to approach for that, unless Kate, you have some additional or better information on that.
Yeah, no, I think that's accurate. I would also say that the Port Townsend Community Center, right before COVID, had started a drop-in center for LGBTQIA plus youth, and that of course got derailed by COVID, but we did work with Parks and Rec to kind of figure out how to make that safe space available for youth in the evenings. It was just one evening a week, but some of that work's been done, so that might be worth revisiting too.
Thank you. Any other ideas on that one? Okay. This is about gathering insight, focus groups. You know, we had some new folks. I'm just looking at updates from our last meeting. I don't think we have Denise or Apple here, so we might not. Does anybody else have anything to add to this? I might need to check in with them individually. Okay.
I don't have an update. I know I spoke with Denise and she had mentioned that she was going to reach back out to the school districts. As a ESD employee, the guidance was, you know, we can provide information to school districts, but then it's really up to them, unless it's something that's a policy or procedure that's required. You know, we're really there for support, but not to push an agenda. Even though we all, everybody agrees that more support is needed around suicide prevention and behavioral health services. So Denise had mentioned that she was going to reach back out to them.
Thank you. I hear what you're saying about that sort of careful line that we're walking, offering service versus pressing services that there's bandwidth for. Support and augment the ongoing efforts to develop family navigation. Any updates on that you'd like me to note here? Okay. The resource map. I think that we have a document that is up and linked on the website on the youth age band web page. Also, I wanted to let you folks know, I just today got a new updated yellow card if anybody would like it. The wondrousness of this card is that, one, it has the correct phone number for our suicide line hotline, and it has several updates that were given from various folks. There's a narcotics, I think it's called, it's the line that you call while you're using. So there are several new numbers on this now, and it's available, and I'm pushing it out to whoever would like some. So let me know if you have any need for some of these to hand out. I think that's all I have. Go ahead, Kate.
Yeah, just a couple of things I was trying to read quickly, and I see that our work plan, or I can't remember the name of the document you were just scrolling through, is not in the meeting materials. So I didn't have a chance to see. Did a couple of things. One, I think two slides ago, I was looking to see if the fact that the county has now hired a mental health navigator to work with the sheriff's deputies. And I'm forgetting his name. Maybe some of you know him. He came from
Steve Eccles is his name.
Thank you. Yeah, so comes from a mental health background, and was really pleased to see that that's incorporated now. So I don't know if that was on the list, Lori. And then just one other thought on the first slide, the adults in the community trained in suicide prevention. I was wondering if it would be possible to think about extending that to training for Narcan use also. And I don't know that needs to just be adults, youth, I don't know, but I'm certainly aware right now of the need to have more Narcan in the community and folks who are comfortable administering it.
And Susan, maybe, is there anything you'd like to say around that, around the naloxone and naloxone training in the schools?
I'm all for it. I don't think there's any reason why teenagers couldn't have the training either if they are interested. I think that would be a good thing. And, I just did CPR this morning. This is the first round that they finally are actually including naloxone in that, which was really good to see. I think it's still a little bit rough because they're suggesting things that probably aren't necessarily ideal, that down the road they'll have a different tune, but it is in the curriculum now, which is really good.
So is there, rather than calling, I think for some of the conversation that I've had, the idea of training kids is maybe a hard one to think about going out to parents with, and I don't want to put schools in the place of shouldering that on top of everything else that they are. I'm wondering if, as Susan is saying, it's included as a CPR training or first aid training, if there's a possibility that we could have a more global term and naloxone just gets tucked into that. Maybe that's a way to think about how we raise that profile in the schools.
Lori, I wonder if we're keeping a list at all. I think it would be a great thing to ask the youth in that focus group section is how would they like to learn about it? Or would they like to learn about it? And in what setting do they think it would be helpful? So they could kind of direct us to where it needs, if it's not universal, where can we do that training? Because I think it's an awesome idea as well. And while I'm unmuted, the other thing that has been coming across in clinic a lot lately, like in the past year, is just the need for therapists who work with transgender kids. And I'm sure a lot of you have been hearing requests about that as well. So just putting that on our list of community gaps.
Okay,
And if you have great ideas, send them my way. Thanks.
good, thank you.
Rebecca Williams, that is our therapist in Chimacum. At the end of the school year, that's her specialty, is working with that population, and she will be 3 days a week coming in the summer and is doing in-person and telehealth for teenagers. So she'll have about 18 spots available in June.
And that's through MCS?
Yes.
Awesome, thanks.
I was also just alerted to a provider database specifically for people who are throughout, I think, Washington State and specialize in affirming care. So I'll drop that in the chat as well.
Thank you, Alexa.
Thank you.
Any other thoughts? We're at 12:58. I want to let you all go. I know you've got meetings to go to.
We're also working on creating a free LGBTQ plus group for teens. Rebecca and Amy, my therapists, are working on that and trying to bridge that gap as well. So we'll let you know when we do that, but probably in June.
Okay, thank you.
That's awesome. I hope that you're working with Bo Ulgram on that, because he also is working on that too.
And just on a different note, I put in the chat the contact person who I've been working with at Fort Warden Managing
great.
Group. So
Thank you for that. That'll be
Sure.
useful. And then I wanted to highlight to you folks, when we send out the invitation for this meeting, in it, you have the link that takes you to the strategic framework that we were looking at, as well as the slides for today. So feel free to look for it there in your invite. Okay, thank you, everyone. Have a great day. We'll see you next time.
thanks. See you later, Lori.
Bye. Have a good afternoon.
Yeah.
Hey, Molly. Did you see, Molly, are you still there? Did you see my question about, is there providers that are doing transgender care?
Yeah, I wasn't quick enough. I sent a little note back to you, but
Oh yeah, there it is. I see it.
yeah, yes, there is, and there's a link on our website to providers who are gender affirming positive. That doesn't necessarily mean they actually provide gender affirming medications, or but they will see them in consult and then help decide, where to go. I think for kids in particular, I don't think that's a much bigger, it's a bigger deal than for an adult who's already gone through puberty, et cetera. So it's a little more touchy, and we often will refer to children's for that, but they can definitely stop with us first.
Okay.
Yeah.
Great.
Thank
you.
Yeah, you're welcome. Bye.
Hey there.
Thank you for coming. I know you had a crazy morning there.
I just had to drive as fast as I could because I got to be here for Chimacum. So anyway,
Right.
so I probably missed something really interesting.
There were a lot of good updates. I'll have to put together some notes and then.
Do you have a crazy rest? You still have a crazy rest of your day? Okay, I'll let you go.
Okay, all right. I'll talk to you soon. Bye.
Bye bye.